Hi, I'm Mary Kay Bates, Community and Business Development Director with Scripps Mercy Physician Partners. Thank you for joining our webinar with our partner Phreesia, Boosting Appointment Volume with a Patient-Centric Experience. Today we'll share how you can use digital tools to increase appointment volume, streamline scheduling, and quickly fill gaps in your schedule due to cancellations with minimal staff intervention. Our speaker will explain how her practice has reduced no-shows and made it easier for patients to schedule appointments. This webinar will be about 30 minutes, including a Q&A session at the end. And with that, I'll hand it off to Adam Rubenfire, Content Manager at Phreesia, to get us started.
Thanks, Mary Kay. We're excited to once again partner with Scripps Mercy Physician Partners for this fantastic webinar. Attendees can submit questions at any time using the Q&A widget at the top left-hand corner of your screen, and I will ask as many questions as time allows. In the resource widget on the left-hand side of your screen, you'll find a one-page overview of Phreesia, a blog about how to craft a patient-centric appointment strategy, and a white paper about healthcare consumerism, which we'll reference during today's presentation. We're also including replay links for our two most recent Front Office of the Future webinars. Check them out. If you have any technical difficulties, please click on the Help widget. It has a question mark icon and covers common issues. And since it's always one of the most frequently asked questions, this session is being recorded and you'll receive a link by the end of the week. Now, our session today is going to start with a quick introduction of our guest and Phreesia. Then we'll discuss what a patient-centric scheduling experience looks like. We'll offer strategies for boosting appointment volume, especially for preventative visits. And we'll spend the majority of our time in Q&A talking to our panelists about her own experience. Now, speaking of our panelists, I'm so thrilled to introduce our guest for today. Brooke Sodahl is practice administrator for MyOBGYN, a Las Vegas-based OB/GYN practice. She has over 10 years of experience in marketing, strategic development, and project management. In Brooke's role, she's focused on optimizing current workflows as well as strategizing for business growth. We're thrilled to have you here today, Brooke. Thanks so much for joining us.
Thanks, Adam. I appreciate it.
Fantastic. All right, so now just a few brief words about Phreesia before we launch into that presentation. Phreesia is a SaaS technology company guided by our mission of creating a better, more engaging healthcare experience for patients, providers, and staff. Now, we have real-time integration with all the leading EHRs and registration, scheduling, and billing systems. We're a publicly traded company on the New York Stock Exchange. We've been rated #1 in patient intake management by the research and insights firm KLAS 4 years in a row. And our security and privacy efforts are recognized with the industry's top certifications. If you're interested in learning more about Phreesia, you can request a consultation using the drop-down on the right-hand side of your screen or visit phreesia.com. All right, let's launch right into our presentation. I'm going to start us off by sharing two exciting findings from our survey of over 4,000 patients, which we shared in our Healthcare's Digital Transformation white paper that you can download from the resources widget on that left-hand side of your screen, as I mentioned before. So what we found in this survey was that more than 4 in 5 of these patients surveyed said they'd use digital tools to book or reschedule appointments if offered by their doctor's office. So 84% said they'd book appointments using online scheduling, and 82% said they'd use online appointment systems for rescheduling. It's clear from the survey data that patients are eager to use digital tools when they're available. And on the next slide, I'm going to discuss why. So patients, when we asked them, when we asked patients who booked an appointment online in the past 12 months, why they chose to use the web to do so, they said speed and convenience were the biggest reasons. So as you can see, 55% of patients said they did so because it was faster than booking over the phone. 38% said they liked to be able to see all the scheduling spots available to them. And 31% said they liked that they didn't have to call during business hours. So all of these reasons point to the need for a patient-centric scheduling experience. But I do want to emphasize that last point. Patients appreciated that they could schedule appointments at a time that was convenient for them, not only when the office is open. When we meet our patients where they are, when we make ourselves available to them, regardless of when our staff are in the office or when our office hours are, we make it easier for them to book appointments, which ultimately is going to help us book more. So let's talk a little bit more about what a patient-centric appointment experience looks like. First and foremost, we believe that you're putting patients at the center of the experience when you give them the ability to manage their own care. So that means giving them the ability to self-schedule their appointments at any time of day, or for those organizations that prefer appointment requests, using an online form and enabling staff to communicate with patients over two-way text to get their appointment scheduled instead of calling. It also means reaching out to patients proactively via text or email to get them scheduled for preventive or follow-up care. Many healthcare organizations send out emails encouraging patients to book appointments for routine care. But if you're asking them to call you to book an appointment in response to that email, they might not follow through. It also means engaging patients to reduce no-shows with automated reminders that encourage them to confirm or request to cancel or reschedule their appointment without any staff intervention. That ensures that you can get ahead of gaps in your schedule without forcing your staff to constantly reach out to patients. This puts patients in control and helps you make room for other appointments. And to take that strategy a step further, an automated schedule management tool can automatically identify gaps in your schedule, offer them to patients who may want an appointment sooner. That kind of tool not only makes patients happy because they get in more quickly for high demand appointments, but it also can help you balance your schedule across providers and physician extenders. Last slide here before we get into our Q&A. I want to talk quickly, sending email or text outreach is an important way to get appointments scheduled for routine and preventive care. We talked about that before, but before we get into the Q&A, I just want to talk about how we can go a step further in meeting patients where they are. So here at Phreesia, we recommend, in addition to that direct outreach, those health campaigns, that we identify patient needs during the check-in process, during intake, and get appointments scheduled to take care of those needs right then and there, right within that process. The example you see on your screen is for flu vaccinations. Every year, many of our clients ask patients whether they've gotten their flu shot this year. If they haven't, we offer them the ability to self-schedule a flu shot immediately, or if possible, to add immunization to the visit they're already checking in for. Again, this is an effort. You're going to hear this recurring theme of getting patients to do what we want them to do, to make it easier for them to do that. Schedule more appointments. And it can be used for any number of scenarios: annual wellness visits, mammograms, and more. We can get them to do it right as we're asking them the question, have you scheduled this routine appointment? All right, and with that, I'm going to launch right into our Q&A with Brooke. Brooke, I'm thrilled to jump into Q&A. Let's just start by asking you to share a little bit about your organization and the patients that you serve.
Yeah, so I work at an OBGYN practice here in Vegas, like you talked about, and really it's a pretty underserved community. So there's a provider shortage out here, and we are trying to just maximize the patients we see, but do it in a way where they don't feel like they're just a number going through the line. So we're trying to come up with personal ways to engage with our patients, but serve them all at the same time. So it's a little tricky.
Yeah, absolutely. You all should go check out their website as well, because they have a beautiful office. But, Brooke, I do want to talk a bit about how online scheduling has helped. Like you said, you have a provider shortage, you have an underserved community, so you need to be careful about spreading capacity across providers at your practice. How do you ensure that you have equitable capacity, that you're spreading it across any providers at your practice?
It's actually really interesting because one of our providers seems to get a lot more of a following than some of the others.
Yeah.
And so with online scheduling, it's been awesome because they'll see that she's maybe booked out for a couple months, but then they'll just click next available and it'll be like, oh, but I can get in with so-and-so next week. And so that's been really helpful because instead of them just getting frustrated that they can't see the one person they wanted, they can see all these other people that might be able to help them. So that's been great.
Yeah, and you use self-scheduling, correct?
Yes.
Got it. Online. So I think what's interesting about this too, Brooke, I think you told me that you brought on a new provider and you were able to fill their schedule very quickly. Can you tell me a little bit about that?
Yeah, it was very stressful, but good. I did not think that was going to happen because we always hear oh, it takes 6 months to ramp up a new provider. So I'm anticipating the worst. But we added her to a practice. We did a campaign through Phreesia. And so we sent out this email that was like, hey, welcome, Dr. Kassar. We're so excited to have you. Click this link to schedule an appointment with her. And literally all of her spots were filled starting the first day of employment. And she was mildly panicking, but she did great. She was just like, it's fine. We got this. She's a pro. But I was just so surprised because I never in a million years thought all of her appointments would be booked on her first day. So I was like, okay, next time I will make her schedule lighter in spots so there aren't as many to fill and spread them out a little more. But luckily she's great. So it wasn't that much of a problem. But yeah, it was awesome.
Well, I mean, in the long run, she'll have more patients, over time. So that's great.
Good problem to have. Yeah.
Excellent. I imagine, so you use an automated schedule management tool, Appointment Accelerator too. I imagine that helps you also kind of make sure that you're spreading appointments across providers. Do you find that?
Yeah, so we have it set up differently for each provider. So some of our providers are very specific, like I want to see all of my patients and I don't want to share them with other people. And some of our providers are like, yes, if someone could help me, that would be awesome. And so it works out really well. So I set like the sharing is caring provider to be like, yes, you can book their telemed appointments with anybody because those are just med checks or like quick follow-ups that anyone could answer. And then the other people I have it set so like, nope, if appointment for them opens up, you can offer it to someone else, but make sure you don't offer up someone else's appointment. And it has worked out really well. No one's complained, which like I take that as a huge win because everyone always tells you if something's not working well. But yeah, no, so I've really enjoyed the feature.
Yeah. So Brooke, if you didn't have Appointment Accelerator, if you weren't using a tool like that, you'd basically have to have how would it work? Would you have a scheduler that would basically have to look at the schedule and try to rearrange things?
Yes. Well, I would like to say we have time to do that, but we don't because our phones ring all the time. So like my one favorite thing about the scheduling online is that it's like reduced our call volume, which has been lovely. But then also like our scheduler didn't have time to be like, oh, someone canceled today. Excellent. Let me see who I can put in there. It would just be a spot gone. And so now it's nice because the patients get the text ahead of time to be like, do you want to cancel, confirm? If they cancel, it opens up and then Appointment Accelerator will bring other people in. So it's like, we don't even have to worry about it, which is really nice because we weren't worrying about it before, which is not the best answer, but the reality.
That's great. Yeah. I mean, Brooke, one of the questions we're getting, my practice has a high no-show rate, this person has said, and is asking for tips around reducing no-shows. Do you have any thoughts on that? Has Appointment Accelerator been helpful there?
Oh my gosh, I have a lot of thoughts about no-shows because I think about them all the time. First, I'm going to make this answer way longer than anybody wants, but
go for it.
So I run a report through, we use Athena, and I run a report that shows the no-shows by provider and appointment type and time of day. So I look to see all of those things to be like, okay, maybe it's all of the emergency visits on Monday morning that aren't full. And so then, or that people no-show because maybe their problem got solved over the weekend or something like that. So I try to like think about the reasons why someone would no-show at first, and make the schedule template a little bit more logical to like sift through that. But then to like fight the no-shows that just happen. I love the text messages that go to the patients because it goes like, I think it's like, we have it set up 3 days ahead of time and then one like the same day of your appointment. And so then they can be like, they know by then if they're not coming. So they're like, actually, I'm not coming. And then we are like, okay, we have the rules built in I think it's like Appointment Accelerator. I can't remember the exact term, but in that program, we have all the rules that are like, if it's this kind of appointment, you can book it within, 2 hours of when the appointment is, because maybe there's not a lot of prep for that appointment. And so then it will reach out to all the patients in the morning if like a 1 p.m. slot opens up. And so that's really helped fill some of those gaps, which has been really great.
That's great. Yeah, that's a big part of Appointment Accelerator is saying, we want to fill this gap. We don't want, yes, we're going to have somebody cancel last minute, but if there's somebody else who wants this really high demand appointment, which by the way is probably, I imagine you have a lot of high demand appointment types for Appointment Accelerator. I think for OB-GYN, I think one of the things you mentioned to me, Brooke, is that you do have some customizations around provider, around appointment type. Are there specific appointment types that you find you really want to get people into and you want to have specific rules around?
Yes. But weirdly enough, it's kind of the opposite for our practice.
Oh,
there
really?
are appointments that we don't want to pull people into. And so the thing I love about your software is that you can make these do not move rules. And so because like our staff is panicking. They're like, Brooke, everyone's going to get a text. They're going to get pulled into the wrong appointment. You're not supposed to see them. They need like a 3-month window, whatever, all of their reasons. but you just build in all the rules. And so it's like, okay, if it's a 3-month med check, somehow the software scans for it. And it's like, I will not pull it closer than 3 months. Or if it's an annual, I won't pull it closer than a year. And so that's been really nice. But yeah, so it just knows all those rules and luckily just pulls in the right people. So that's good.
That's great. Yeah, no, it's important to be using it the way you want to use it, not the way it's like prescribed that it needs to be in a certain way. That's fantastic. Yeah, Brooke, I would love to talk a little bit more about best practices. We talked about preventive care. Also, I think it's important in your space to talk about both preventive care and elective care. How do you encourage patients to seek you out, for preventive care, whether it's, might be, certain maternal needs or lactation classes or those kinds of things. Tell me a little bit about how you work to get patients to come in for those kinds of needs.
This is like my favorite topic.
Good.
I think
Let's
it's the
get
best
into
thing. Oh my gosh. Okay. So we use Canva for our marketing, which is like amazing. So we just make like a really quick, I don't know, marketing flyer type thing. And then I put it into a campaign. So it's like for our lactation class. If I know that we're adding, so we just did this, we added a new class for Fridays. And I wanted to let everyone know we had it. And so I just made something quick in Canva that was like, hey, we have another lactation support group. We'd love for you to come. And then I run a report in our EMR, which is like, I've already made the report that fits the requirements. So I just like filter the patients by like, okay, have they had a baby in the last year? Yes. Are they going to have a baby in the next couple of weeks? Okay, I'll get them too. And then I download the report so it has all their emails in it. And then I just upload it into Phreesia. I create a campaign. It maybe takes like, I'm a little slow. So I will say it takes me like 15, 20 minutes to like.
That's pretty fast.
Well, I know. And I'm like, so if I'm slow and I can do it in 15, 20 minutes, I feel very good about this for anybody.
Yeah.
But it works so great because then I just literally click the button and it's so fun because you watch it go out to all the people and then you can look and it's like a weird game. But I just like watch the appointments fill up and it's like, heck yeah, this totally worked. But it's really awesome because then her schedule's filling up, which is nice. We're also telling our patients about it. And some people don't know that we have some of these things. So it's like a great marketing tool, but also fills our schedule, which is what I really like.
I love that. This is the gamification of the front office. That's the front office of the future right there. It's entertaining our front office and practice supervisors. So that's
it's just me in the background being like, yes. And you're like, why are you so excited? I don't know.
I just picture Brooke sitting back with her mug and just watching the appointments come in. It's great. I think you also. Oh, go ahead. Sorry.
Oh, I was going to say it's oddly true. That's like literally what happens. It's great. I love it.
Well, I think you told me that you also you take that self-scheduling link and you've made a magnet with a QR code on it, right?
Oh, yes. I forgot about that. Yeah. So for our deliveries, what we did, we have it for two things. For like an annual reminder, we have a magnet that you put on your fridge that's just like MyOBGYN, like something kind of witty and a QR code. But then for anyone that delivers a baby, we have our business cards. We did two things. Every provider's business card has the QR code on it now to just bring them to self-scheduling. And then we have like specific ones that we hand out that are like lactation specific. So if like you have lactation questions or just any feeding questions, like it literally just says feeding, weaning, like question mark. And they just scan the code and then they book it. And it's nice because they can book their postpartum appointment with that. They can book any lactation appointments, anything they want. It's just like right there. And they're like laying in bed in the hospital anyway. So it's like the perfect time to give it to them. And usually it's like 2 a.m. when we can't answer the phone here. So it's perfect.
That's awesome. Yeah, that's really great. I mean, just as many ways as you can to get people to those self-scheduling links. That's awesome. So Brooke, we know that you're really enjoying watching those appointments get scheduled and the emails, but of course it's about Brooke, but it's also about a lot of your other staff. Tell me a little bit about how other staff have responded to these, the technology supporting their jobs. Is it making their lives easier? What are they saying?
I'll be honest, at first they were super nervous and I had to like gently rip off the Band-Aid. I'm like, it's okay, you guys, like we won't do it all at once. And so what we did, we layered in different appointments at different times. So we just started with like what our scheduling team deemed like the most basic, just to like get their feet wet and build their trust in the system. So we did that, and just like annuals or something that, is no crazy rules. And so we started there, and then they're like, oh, actually, we are getting fewer calls. And actually, so then after we layered on all of the different appointments, we had just hired another scheduling person. And the one that was existing came to me. She's like, Brooke, I know, we may not have as many calls coming in anymore. Like, they were panicking because they're like, I know we don't technically need a second phones person anymore, but like, what are you going to do? And I'm like, oh, this is actually perfect. I have like 30,000 other projects I want to give somebody. Now I can just give her those projects. Like, this is perfect. And so I love it. And then they love it because they don't have to deal with all these angry people calling all the time. And yeah, it's been easy, and they haven't complained about it being wrong too many times. So that's good.
Hopefully it's not wrong too often.
I know. Well, there's a couple times where they're like, well, I'll be honest, it's before we turned on the cancellation text message, because we weren't doing the confirming or cancel your appointment. And so people would book a bunch of appointments because they just didn't want to call to cancel it, and they would just book another one. But now that we turned that on, that has stopped that. So that has been been a lot. Yes.
Got it. Yeah. So you're saying the system, if they cancel, or it tells them, do you want to cancel the appointment? You have more than one appointment, or?
No. So what was happening where people were trying to, let's say it was in the morning, like I was scheduled to have an appointment today at 3, and I was like, oh shoot, I have a meeting. I can't make it. I'm too busy to call the office, or like just really don't want to. So they wouldn't cancel their appointment, and then they would just book another one online.
Oh, okay.
Because we weren't giving them the option to cancel, because we were kind of scared of what would happen. But no, it turns out you should just turn on that feature and just let them cancel, because then it pulls in new people, and then they just book one appointment. It's like way better that way. So do I regret not doing it right away that way? Yes, but it's okay. Baby steps. I can't get it perfect the first time.
Sounds like your message from that is have faith in the system, have faith in the technology.
Here I am saying my staff was the ones that were nervous, but I was like, but what if everyone cancels all their appointments? I don't want to let them have a free out, but I'm like, they're just not going to show up anyway. So I might as well.
What is your lesson there, Brooke? Is it that, is it about working with your vendor to make sure that you understand the solution? I mean, how do you resolve an anxiety like that? Because we all do have anxieties when we implement things.
Well, to be honest, I think for us, and me specifically, it was kind of just tiptoe into it. You don't have to jump in all the way all at once. You can do it slowly and then build trust, because this is new, especially, I mean, I don't know how everyone else's practices, but a lot of medical practices are mildly archaic. Like, yeah. I don't know, we had like paper everything. And so it was a huge change for us all over the place. And so then it was like, okay, I guess you guys know what you're doing. I'll listen, and I'll turn on yes, it will work. Okay. And it did. Like, people weren't just canceling for fun. It was truly the people that weren't going to show up anyway. And so we might as well fill those spots.
The one thing you mentioned that I thought was really interesting. You said you hired this person, but you didn't really need them for scheduling. Have you found in general that when you're using this type of technology, you're deploying people more efficiently?
Oh my gosh. Yes. That is literally my favorite thing, is because now there were so many things that I felt like just weren't getting done because overhead is super expensive. And so you can't just justify hiring 1 million people. And so this took the burden off of our scheduling team to allow them to do better in other areas. So like now they can get referrals out quicker. They can help with FMLA paperwork more timely. They can like actually respond to patients' messages like with real concerns, not just scheduling. And so that's been really great. And our patients have been a lot happier. We used to get a bunch of complaints about like, no one answers the phone because people are just calling all the time to schedule. And it takes a long time to be like, how about Tuesday? How about Wednesday?
Yeah.
So now like that's been taken off their plate. And so patients can actually get through quicker too. So that's been great.
That's lovely. And I imagine, this webinar, we're really focused on scheduling, but I imagine that digitizing intake has been helpful for you as well, because that's another thing, even though that might be in a traditional practice, it's taking place on paper in person. But I assume that frees up people on the phones, it frees up people in your staff and lets you, tell me a little bit about that. Has that helped you use people more efficiently as well?
Oh yes. Like the amount of scanning we would do, the amount of trees we were killing, like all of those things just like hurt my soul. And then to be like, why? Like, you're just wasting so much time by like having someone fill it out. And then we couldn't even have it tie in. So then they had to type it all in. And I was just like, oh my gosh, this is actually killing me. So no, the digital intake has been my hero, but I know this isn't about this, but the payment assurance has been like, that's where I'm like, yes, this is actually making us so much more money. And I'm so grateful.
No, feel free to talk about payment assurance. We've asked our scheduling questions. Tell me about what it's been like to, I mean, in general, especially in a practice, right? There are some people who are wearing multiple hats, right? So tell me, I mean, just in general, what's that been like for you to be able to take payments out of the hands of your staff and let it be a little bit more automated?
It's been so amazing because now patients know ahead of time what they're going to owe, which is great for them not to have that surprise. And the No Surprises Act, all that stuff too is happening. So it's like, okay, we have to educate our patients ahead of time. It's been a lot more accurate in actually getting the funds, but really I could say so much about payment assurance and how much fun it is for me to like actually play the game. Oh my gosh. When you download that report and put that in and you literally see just like dollar signs coming in, you're like, ding, 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 ding. Like, oh my God, this is amazing. But that's how I can absolutely justify the cost, is because it's truly bringing us so much more money. And so the first month we implemented in August, and we collected 60 grand more that month than we typically do, like from patient collections. And so for me, I was like, okay, yeah, I can spend, whatever this is over here on the software, because it truly is making us so much more money because we're actually collecting money now instead of not, which is sad, but true. So I love it. I'm obsessed.
That's great. And I mean, one of the things we found, you could tell me whether this is, real, your practice, it might be hard to quantify, but we have found, we have data that shows that when people check in ahead of their appointment, we actually reduce no-shows just because they did the work beforehand. Have you found that at all?
Yeah.
Is it something you've thought about?
Definitely. Well, because they're also paying their copay ahead of time too.
That's right.
Nice. So like they've already committed to this. And so they're like, well, I already paid, I might as well just go, which has been awesome. But also by not having a bunch of empty spots in your schedule too, you're increasing the amount of charges that can go. So really you're seeing that side of the financial impact just by having more appointments, but then you're also actually collecting the money. And so it's just like, yes, like this is what I needed in my life. So thank you.
Well, that's fantastic. I'm so glad we were able to give you what you needed in your life. It is interesting, Brooke, though. We often think of schedulers in one bucket and billing and payments in one bucket and intake in another bucket, but really they all go together, especially when you're working in a digital medium. When people check in, they've paid their copay and that's been taken care of, and we've verified their insurance. And when, people have scheduled ahead of time and they've self-scheduled, they've taken it upon themselves to do that. And by the way, that leads to more revenue down the line when they go to their appointment. So that's wonderful. Thank you for that, Brooke. I want to ask one more question, and kind of a broad, like looking into the horizon question. When we think about healthcare organizations that want to implement online scheduling, maybe they want to go from having schedulers who work on the phone to this kind of system, or even, folks who are like you went from paper to digital intake. What do you think they should prioritize? What advice do you have for them on where to start and how to think about it?
Don't make it too hard. I think that was when I came into this practice, there were so many very specific things that needed to happen. So it's like, oh, you want an IUD, you're going into an IUD appointment, like you want this very specific thing. We have one here, one here, but instead we made it a lot more generic. So we're like, are you new or are you existing? Like let's keep it as easy as that. Like, and is it pregnancy related or is it just gynecological? Like, what kind of visit is it? Like, so that's really how we broke it down. And that way there's so much more availability for the patients. So when they're looking to book, it's pretty straightforward to be like, here are these two questions. And then I love the alerts that are like, if it's this, don't do it. Like it's really nice because I'm like, I don't feel bad if you booked the wrong thing because it literally popped up in your face saying, don't do it. So that's on you. So I don't have any guilt. But anyway, make it easy and just, make it as basic as possible and kind of foolproof. And that was it. Like, I think that's really the thing that helped us the most was just dumbing down our schedule to make it more flexible.
It's interesting to hear. It is a common story we hear that when launching into this kind of exercise, it's often we often talk to practices or health systems that say we went from having hundreds of even appointment types to having just a few. And that was an important exercise, especially when you have multiple locations. That can be a huge problem when you have multiple locations. So that's really helpful to hear from you. Thank you, Brooke. Well, thank you so much for your time today, Brooke. This was a fantastic conversation. I don't know about you. I had a lot of fun. So thank you for that. I'm just going to flash up on the screen a thank you slide here with some information. That's all the time we have for today. So if we didn't get to your question in the chat, or if you have any questions about Phreesia, please don't hesitate to request a consultation using the form on the right-hand side of your screen. We'd love to be in touch. Thanks again, Brooke, for joining me for such a wonderful conversation, sharing your best practices and insights from your practice. Thank you so much to our audience again for being with us today. And thanks, Brooke. Have a great day, everyone.